And welcome back. Now, what started in the town or the city of Wuhan in central China in 2019 has now sprung up on all continents in the world except Antarctica. New cases of coronavirus are being reported every day. The World Health Organization has since named it coronavirus disease 2019 or COVID-19. And there are concerns that the virus can have an incredible impact on the world's economy as well. The National Institute for Communicable Diseases is currently the only laboratory performing testing for SARS-CoV-2 in South Africa, and the institute says that the country has not had a case of COVID-19 to date. Dr. Sibongile Walaza, medical epidemiologist at the National Institute for Communicable Diseases, is here to update us on this coronavirus. Thank you so much for your time this morning, Dr. Walaza.
Thanks for having me.
So let's start with what this coronavirus actually is. Is it something new? Where did it come from?
So coronavirus is a group of viruses that cause illness in humans and in animals, and the name comes from the structure of the virus, that it has at the edge it has got spikes that looks like a crown. So that's where the word corona comes from. And there are some coronaviruses that cause common illnesses like respiratory illnesses. There are about 4 of them, so that commonly circulated and cause disease in people. But sometimes it happens that a coronavirus that causes an illness in animals then changes its structure and is able to infect humans. And when that happens, then we get situations like the COVID-19 that we have now. We've had instances before, like the SARS, which was in 2002, and then the MERS coronavirus that was in 2012.
So how then did it go from animals to humans?
So that's still what we're still trying to find out. That's part of it's a new disease now, this one, the COVID. That's why earlier on, I think if you follow the what has been out in the news, that we called it a novel, which was a new virus. So when it is new, then we try and find more information as possible. But what is being reported for now is that they normally come from bats. They normally infect bats, but then they'll have an intermediate host. Like, for an example, the one that's been quoted now but still has to be confirmed is a pangolin. So you've got an intermediate host, and then it's contact with that intermediate host that then causes the disease.
Well, it's all very scary at the moment, and I think part of this scare factor is the fact that we don't know enough. And what we do know at the moment is that this morning, the first sub-Saharan case of the coronavirus confirmed in Nigeria, which brings the total number of cases on the African continent to 3 to date. There was Egypt, Algeria, and now 1 in Nigeria, which brings us to our preparedness as South Africa. How prepared are we at this stage?
So in terms of preparation, I think the first thing that each country does is to try and put themselves in a position that they're able to identify cases as soon as possible for exportation. So we put, again, look at case definition, who should you screen? Then when you have that, and then you do the screening with the hope that you can catch people coming in. But then as with other infectious diseases, that sometimes it happens that a person who is infected that is asymptomatic, especially in the early stages. So it's possible that you miss those when they're coming in. But then the important thing is that to get the message out there that if people have traveled to areas where there's circulation of the disease, then they need to be on the lookout when they're having respiratory symptoms, that they are able to identify those and they are able to seek care. So we've done that sensitization. I mean, we've screening at the ports of entry, and also providing training to clinicians and also to healthcare workers, so to help them be in a position to identify a person when they come and present. And again, just to say, when people are traveling to these areas, we're saying again, in terms of the population, that they must just make sure that when they, for example, if they go to a place where there's community transmission, they make sure that they stay away from sick people, and they practice good cough hygiene, and also they wash their hands, because in terms of the transmission, it's transmitted mostly by droplets. So if people practice hand washing, and when they cough, they protect their coughs. So there are ways that a community can protect themselves.
I mean, at the risk of becoming a whole bunch of hypochondriacs at this point, one is now scared, you know, to even stand next to someone who's coughing because it presents with flu-like symptoms, I understand.
Yes.
So let's just talk to that. Well, what exactly should one look out for?
So as a viral and a respiratory illness, you're right when you're saying its symptoms are like flu, but then even for all of them, like including influenza, we say that, again, when people are coughing, so just to make sure that they practice, when they cough, they protect the coughs and they wash their hands regularly. And again, when people are starting to feel sick, like if you've got a fever and you're coughing, just try and protect other people and stay away from work and stay away from school. And when you're coughing or in a room with other people and you've got respiratory illness, just keep the distance and maybe about 2 meters. If you have to cough, just move away and just trying to protect other people. But then if everyone practices safe hygiene, that you frequently wash our hands, because when you touch surfaces, you don't know whether someone in the room has coughed or the particles have fallen onto the surfaces. So if you wash the hands regularly, then that would be that's a way that people can protect themselves. But the important thing is that when people are symptomatic and they've been to areas where we know that there's community transmission of the disease and they are symptomatic, they need to contact their health provider and just let them know that I've been to this place and these are the symptoms.
So it may seem melodramatic, but would it be helpful to wear masks?
So the masks, so we're saying for people who are symptomatic, right? Because when you're saying it's respiratory hygiene, we're trying to protect the respiratory droplets from spreading. So it's someone who can tolerate, if the people can tolerate it and they are symptomatic, they can wear the masks. But then we're not saying everyone who's out there must be wearing masks, because that's also not sustainable, and there's no proof that again, just people wearing masks, everyone wearing masks is effective. But when someone is symptomatic, they need to protect themselves. But then in terms of the healthcare professionals, people who are working with sick people, again, there's protective measures that they have to take. So they have to wear the masks, and they have to wear, again, protective clothing like the aprons, and to protect their eyes.
So, Dr. Walaza, one of the daily papers this morning is reporting that there is potentially a case of coronavirus at one of the Johannesburg hospitals. Have you heard anything of that?
So I've not heard anything of that, but then again, in terms of testing, in your introduction you mentioned correctly that the National Institute for Communicable Diseases currently is the only lab that's doing the testing. And from the people that we've tested close to 400 people, and who were suspected of having the coronavirus. Out of those, about 90 of them met the criteria which we use to say this person has to be investigated thoroughly. And all those tests that we've done so far have come up back negative.
So nothing referred to you from a Mill Park hospital, because that's what the Star is reporting. They are saying areas been cordoned off for 2 weeks, people wearing big silver suits, nurses unsure what's happening, Netcare denying that this is coronavirus. Has anything been referred to you from this particular hospital?
So in terms of from which facilities, at this point in time, I'm not in the position to say which facilities have referred cases to us. But what I can tell you is that we've got the National Institute for Communicable Diseases has got a hotline number that's out there that when facilities have got a suspected case, they have to phone the National Institute for Communicable Diseases, and we do the testing. And so far, up to today, there's not been a case that we've confirmed that has got the COVID-19.
And then, of course, last night, the presidency releasing a statement about South African citizens in Wuhan city being repatriated. Now, again, this raises our levels of concern about preparedness. How will that process likely be managed from the government side?
Okay, so from the NICD, NHLS side, I mean, what our role is to support the government, and we'll work together with the other government facilities that are responsible in the in moving those people to South Africa. So in terms of, again, in terms of quarantine, the idea is that when you move people, then you should have facilities that are there to, so that you can quarantine people for a certain period of time. So again, before that happens, people are moved, then it's to ensure that those facilities are there. And as NICD will continue to do the testing and support that process. I mean, to test whether people, when they come back, that regular testing to see if they've got the illness or not.
Dr. Walaza, are you privy to, you know, any of the setups at the institutions that were mentioned by the Minister of Health, where people will be referred to should there be any sort of outbreak?
So yes, each province has got hospitals that are demarcated to receive patients. But again, in terms of what we're looking at is to best be a facility where people can be isolated and be able to manage those patients. Yes, yeah.
Are you privy to how the actual training has been done, how these institutions have been set up?
So what we've done is, as NICD, we've provided, together with the Department of Health, we've provided training for the healthcare facilities. So we've invited them and moved from province to province to do the training. So again, in terms of those facilities, the main thing that they have to be able to do is they should be able to have facilities to isolate patients, and also just make sure that they practice droplet precaution, that staff members are aware what to do in terms of infection control. And those protocols exist and are there, and staff have been trained.
And then just broader than South Africa, because the World Health Organization have indicated that they are quite happy with the way in which China has managed this disease, but they are worried about a continent like ours. Have you had opportunity to speak to your colleagues in other countries on the continent, and how are they responding to the coronavirus outbreak?
So as part of the response, I mean, it is a big team that's working on the response, especially for South Africa and then for other countries. And as part of that response, there are weekly and sometimes bi-weekly teleconferences, and also meetings that are being held by different people. So we work together with Africa CDC. So in terms of what is the response in terms of Africa, and you also talk to other colleagues even outside the African continent to see how are they managing it, so that we can find out from their experience the best practices. So yes, I mean, we've got the information, and we are in constant communication, and again with the WHO, so we've got different people that attend the meetings, and we have engagement with them in terms of what's the best way to go about it and what to look out for.
And with regard to the 2 cases that had been reported prior in Egypt and Algeria, have you guys communicated around that?
Yes, I mean, so in terms of that, those are discussed in on the calls. But I mean, in terms of the specifics of the patient, then yeah, we cannot be discussing the particular details of the patient. But again, we do talk. I mean, in those meetings, so it will either be the lab in terms of testing, or in terms of surveillance, how are they doing contact tracing. So we do, as part of the response.
And of course, containment. You know, what are your colleagues reporting in those 2 countries about containing the virus?
So,
or at least the outbreak.
Say that again?
I'm talking about containment, because you've got those 2 cases that have been reported, and how have they gone about, you know, looking at containment?
So with I mean, it's also part of the outbreak response, in that if you've picked up a case, especially depending on how far where the outbreak is. So the main thing is just to make sure that when you pick up that first case, is to make sure that you prevent further transmission to other that it doesn't transmit to other people. So contact tracing and providing information and making sure that the facilities and the systems are there for infection control. So also in terms of the protocols, so other countries like we have, they'll have a protocol to say, when we get that first case, what is it that you do? What it is that you need to do to make sure that it doesn't spread to other people.
So just finally, given that South African citizens will be repatriated from the epicenter of this COVID-19 outbreak, should South Africans be concerned?
So it's what I would say is that, I mean, for this group of people, so if they're being moved in, so there's going to be quarantined. So that's why then the South African government is putting those systems in place, just to, again, as part of the protocol, to make sure that you prevent further spread. But I think what is important for South Africans is that, again, just like any respiratory illness, that, again, to make sure that if someone is feeling sick, they should just try and make sure that they don't pass it on to the next person. This is by, again, staying away from work if you're sick, and then also consulting your healthcare provider, because I think it's have to be a collective effort to try and make sure that it doesn't spread.
Well, thank you so much for your time this morning, Dr. Sibongile Walaza, who is, of course, a medical epidemiologist at the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases.